Our daughter was away at University of Arizona in Tucson. And in January, I started hearing reports of this mysterious virus that had hit another country. People are getting very sick. They don't know how it's spread. They don't know how to control it, and it's becoming fatal. Those are all the hallmarks of a pandemic.
So because I'm heavily involved at the hospital, we were at a conference, and I was also already at that point having meetings with the involved in the meetings with the health department. So it was really actually in February where the alarm bells started to go off, and we were already, as a medical staff at the hospital, like I said, we were at a conference and we were already looking ahead at this, pretty concerned.
For everybody else, we started seeing trends when we started ordering things, cleaning supplies, alcohol. All of a sudden there was a shortage. Gloves for us to use. And then we started contacting our suppliers, and they said, no, there's a limited supply, because the word was out already. Could not get them by March.
It didn't hit us physically until March, when they shut down, small businesses in particular. And that's when we really, woke up like, dang, this is really happening,
It's something we don't believe on this in the beginning. And when we heard that that's really serious, it's kind of shock for everybody.
We've been in the restaurant business for 30 plus years, and we've never seen anything like this.
They say it's the things you least expect that hit you the hardest. It was no different for Merced, the city of Mercy no less, in the early months of 2020. In fact, on the morning of February 7th, the atmosphere on Main Street is electric. At the historic Merced Theater, Mayor Mike Murphy is giving a glowing, upbeat State of the City address. He describes Merced as a strong, vibrant city on the rise in the heart of California's Central Valley, and residents have every reason to believe him. And UC Merced, the newest research university in the state, is growing dramatically, paving the way for a new college town identity.
I hear excitement for a new Merced, a revitalized and refreshed Merced, a Merced where all have a place and a role and a bright future. We get to write our own script.
Yes, it's the things you least expect that hit you the hardest. Exactly 5 weeks after the mayor's speech, Merced and its namesake, Merced County, are in a state of emergency. The COVID-19 virus is spreading, and local residents are about to realize nobody has a script for a worldwide pandemic.
My name is Alejandro Trevino, and I'm 62 years old, and I'm in the business for over 30 years now. 20 years in this is beautiful building, historical building, and we're still here. My parents, they teach me how I can run business when I was little. My dad, he owned a little store in Mexico, and that's how I started learning about business. We do okay. Right now we can do better. And that's like any other business, up and down, up and down.
My name is Alejandro Trevino, Jr. I'm 33 years old. I'm the manager and the right-hand man to my dad. It's a family business. We specialize in a good family environment, and it's a lot of work that goes into that, because family business ain't the easiest, to run. But at the end of the day, we just try our best, and we're here for the community. I think they love it personally, because all of our food is homemade, including the flour and corn tortillas, and that's what people really love, and the beans as well. We've been here for 20 years, so like I tell people, if we weren't doing something right, we wouldn't be here for 20 years.
But no amount of experience can prepare the Trevino family for California's response to COVID-19. On March 16th, Governor Gavin Newsom directs all restaurants in the state to immediately stop indoor dining. 3 days later, Newsom issues a stay-at-home order for all Californians.
That's when we really, woke up like, dang, this is really happening, When Gavin Newsom gave the order and said that restaurants are only allowed to do outdoor dining and to-go orders, that's when it was real. We immediately cut staff. We stopped turning on the air, the heater, whatever, and, we had to hurry. Once they let us do outside dining, we had to hurry and rush to the store to get the things we needed to be able to utilize the outside dining. And, it's just so many things we had to do differently that we're not used to. As we try to adjust, you never know what's going to happen next week.
If I remember the first time, they put a date on it, but they don't respect the date they say. They say overnight, you guys need to close down, and that's it. No more outdoor, no more dining, nothing.
The spacious dining room inside Trevino's, normally packed with customers for lunch, is suddenly dark and quiet. There are no more servers hustling between tables with dishes of piping hot Mexican food. All of that is gone, just phone calls and takeout. Not really what Trevino's is all about. And then those long, empty days turn into weeks of uncertainty. Until finally, in late May, a moment of hope arrives.
I do remember they gave us a month of 25%. We got some kind of, excitement, hey, we get 25%. We made the adjustments needed. We had to prepare our restaurant like we've never done it before, capable of, social distancing, sanitizer all over the place, plexiglass for our register. We went all to-go plates as well, just because, as soon as someone eats, we just throw the plate away and it makes it easier. We don't have to wash dishes. Like I said, we went into save mode. We had to cut costs however we can. We used to operate from 8 a.m. to 9 p.m. And now on the weekdays, we operate from 11 to 6. So we literally lost 7 hours of business because of this. But at the end of the day, we got to do what's best for us to be able to survive this. Like I said, we try to do as much possible to make the people feel safe and let them know, we're not here, we're trying to be safe ourselves. And I think it's only right that, if other businesses can provide safety to their customers, why can't we?
Meanwhile, just down the street, another owner of a small family-owned business is facing his own distinct challenges. Rafael Velazquez is a local pharmacist known for his friendly hometown customer service. He too comes from a family of Mexican immigrants, working his way up through higher education and opening Merced Drug in 1998, 23 years ago.
The goal was, when you work for someone else, you have sometimes very little time to interact with a customer. I want to be able to talk to someone and make sure they understand their medications. And since I am bilingual, then that just helped even more, and that helped us a lot in this community, especially in the area we live. So my name is Rafael Velazquez. My wife and I, we own Merced Drug. We have about 60% Hispanic and 40 non-Hispanic. We have seniors, with Medicare. As you and I get older, that population has a lot of needs, and make sure that they take their medications correctly so that they don't end up in the hospital. And so that's one of the things that's very rewarding, to make sure they understand what it's for and how to take it. And I'm glad that I do know how to speak Spanish, and sometimes it's confidential. It's a very confidential question, and so they appreciate the one-on-one interaction.
Communication between clients and medical professionals will become critically important as the pandemic exposes distinct vulnerabilities in Merced County.
For me, I had a lot of questions unknown. We heard about New York, and it hadn't really hit here in California that bad, at least here in Merced County. And so you started wondering about, do we have the right treatments? And we were all learning in the medical field what it is. We'd get prescriptions for an antibiotic, then you see something else in the news that they were trying to use. And not only here, but because we have family in Mexico, they were using different things than they were using here. And I'd get calls or questions all the time from family members. Hey, should I be taking this as a preventative? And so a lot of the times it was over-the-counter things, so vitamins, those were easy to answer. But when it came to prescription items, I said, no, you have to talk to your doctor. You can't just assume what helped one person will help another. You're on all this Facebook and internet. they were sending them lists or pictures. Hey, can I get this? Can I get this dexamethasone? Can I get this? And a lot of those things were prescription items. But down there, if you have a doctor that recommends it, it's a lot easier to get medication. So they were wondering, can we purchase this? Because they were panicking. You know, can we have this at home? And I said, no, you have to have a doctor's prescription. And even a simple thing as having a solution for a nebulizer. They were wanting to be prepared at home in case the hospitals were full and they couldn't go. And then we started, limiting how many come in. Your customer base, they're afraid to go to the doctor. So those are one of the things that we had to educate patients. I don't want to go see my doctor. And I said, well, you need to reach out to them. They can do it over the phone, different modalities to be able to communicate with your doctor, but don't be afraid. So we were kind of first line, the pharmacists, including myself, to try to encourage people, hey, you have to keep your appointment. And even in the big hospitals, you hear it on the radio, Stanford is, the cardiology department. Don't put off your doctor's visit. This could be detrimental to your health. The doctors were working with these patients very well, whether it be over the phone, and urgent cares were seeing these patients. First they would screen them for COVID, the symptoms, and they would actually see these patients. So we had to educate them not to be afraid to see your doctor, because that was really tough to convince someone, probably for about 3 months, that these doctors are there for you.
The initial turmoil is widespread. Medical masks, disinfectant wipes, and even toilet paper are disappearing from the shelves of so-called essential businesses. However, for local families with children, the enormity of the pandemic really hits home on April 1st, when Governor Newsom announces the closing of schools through the end of the school year.
I think at the time it was inevitable. There was so much that we didn't know. And so we had to do the thing, whatever the thing was that would protect our families, our students, our staff, that had to be done. I think that was the right decision. I think it was the right decision. I wish we'd had a little more training or a little more guidance. I think our teachers and our admin, if they'd had more guidance or maybe more of a strategic plan, it might not have been as difficult. But again, we didn't know. There was so much we didn't know. We didn't know how it was spread. We didn't know what would prevent it. We didn't know how it would manifest. There's so many different manifestations of COVID-19, depending on your health risks, pre-existing conditions, your state of health, any of those things. My name is Birdie Olivares Kidwell. I am the president of Merced City School District's Board of Education. I'm a product of Merced City Schools and Merced High School. I worked in corporate America for over 20 years. I worked as a business continuity and disaster recovery planner. So I had some unique experience with regards to pandemic planning. We are a fairly large city, 120,000 I think during the day, yet we have a small town feel. There are a lot of families here that are large, a lot of overlap in the families, so we're very close-knit, and that makes us a unique population. We have one of the highest percentages in the nation of student population that needs free and reduced lunch, so that makes us a very unique population. We also have a high percentage of English language learners. That's a large portion of our student body. So there are some unique challenges here. I think parental involvement is so important. So I've always been involved. But then COVID hit. My son was in the Merced City School District system at the time. He was in 8th grade. And I started thinking, are we going to shut down? Well, Merced is a very different demographic, right? We don't have the same kind of population density that there are in some of the larger cities. We have the benefit of space. So we weren't necessarily in the same crisis mode that some of those cities were, right, with the close proximity of the people and the very intensive population centers. So we had a little more time to think about it, but we needed to have plans. And at that point, there really weren't any plans. I realized with my experience in the corporate world in pandemic planning, that was my job. My job was to ensure that all of our business units were prepared for any kind of an event, whether it was a terrorist event, a natural disaster, or a pandemic. So I started asking questions, and I realized that there weren't really plans in place. We hadn't really thought about what we would do. And that's what motivated me to seek office. We didn't have a one-to-one technology solution. There wasn't a one-to-one device to each student. We did not yet have that. So I knew it would be a difficult transition to move to working from home for our students. So that was the first issue. We don't have the kind of internet connectivity. We know that many of our families didn't have access to high-speed internet or reliable internet, so I knew that was going to be a problem. And I kept hearing, oh, this will be finished by summer. And I knew from my experience and from my training, this wouldn't be over by summer.
No, this wouldn't be over by summer. Not by a long shot. Instead, Merced County finds itself on a state watch list as health officials closely monitor the rate of new infections and hospitalizations. By mid-April, the Merced County Office of Education promptly sets up a website to explain a whole new world of education for tens of thousands of students, parents, and teachers. Soon, the entire population is being introduced to a pair of words many had never heard or thought of before: distance learning.
Now that schools have transitioned from in-person instruction to distance learning, let's take a quick tour so you can get familiar with the MCOE Distance Learning website. On the home page, there are sections for families, educators, and subject areas, like science, mathematics, history, and language arts.
By mid-May, the Public Health Department is prohibiting in-person graduation ceremonies. Nearly all students in the class of 2020 have no choice but to attend modified drive-by events or participate in a virtual broadcast. By mid-July, state officials are updating benchmarks that will be used along with health data from each county to determine when and where schools can be physically open. With this information, Governor Newsom sets the stage for a new academic year with distance learning.
None of us want to see education virtualized. At least I don't. I know some folks perhaps may think that's a better approach. I believe profoundly in the power of individuals and the cohort and the connectiveness of being engaged with others and learning to develop yourselves, not just intellectually, but emotionally, and maturing in ways where I respectfully submit is difficult when you're doing it online. That said, the one thing we have the power to do to get our kids back into school is look at this list again. Wear a mask, physically distance, wash your hands, minimize the mixing. The more we do on this list, and we do it at scale, the quicker all those counties are going to come off that monitoring list. We're going to mitigate the spread of this virus, and those kids are back in school. So if that's your top priority, it's certainly mine, then it's incumbent upon us to practice not just what some of us preach, but to practice what we preach as individuals that desire to see our kids go back, to model the behavior that we know can mitigate the spread, model the behavior that can actually extinguish this virus.
Even when we were closing schools, already there was information coming out of China and other places that this was not a pediatric pandemic. So we were already getting indications that school closures, while reactionary, may not necessarily have been, even from the beginning, may not have been absolutely necessary. Hindsight's 2020. And my name is Sima Asadi. I am a board-certified pediatrician. I have been in Merced since 1999, is when I first came here, right out of residency in Fresno. My parents immigrated to San Jose from Iran in the 1960s, the early 1960s. They came here to go to school and further their education. And then years later, when I was in UC Davis, that's where I achieved my undergraduate degree. That's where I met my husband. He also, too, is an immigrant from Iran. There is nothing more important to me than education. I am who I am because of an education. So it was a very easy decision for us with the promise of a UC Merced, to move here. So we start to, see the school closures happening. And then I also start to see pretty quickly that no one entity can really manage this pandemic. The health department, so my career in medicine goes back 26, 27 years. What the health department was is not what it is now. So over the last quarter century, I, in my own career, have seen the services at the health department dwindle, essentially. And so early on, most of us that have been doing this for any amount of time recognized that the health department could not handle this by themselves. It really had to be a community effort. No one entity can really handle something like this, a medical catastrophe like this, on their own. So I basically chose to tackle the school part, partly because I'm a pediatrician. And so right away, I started to see, even well before July, I started to see the harm that school closures immediately started having on children, especially in one of the 5th poorest counties in the state. School closures are going to have a huge impact. And so I started to see that early on. And that's one of the main reasons why I got involved, to the point where by July, again, even the picture started to become even more clear, that it was going to take a community effort to get testing going. I was one of the first people to start testing. I was going out to high schools, going out to whoever, private schools, whoever would let me, and start, surveillance testing, which was something that we knew the health department wanted us doing, but there weren't the resources to do it. So I was perfectly willing to do it.
While Dr. Asadi reaches out to private providers for much-needed medical supplies, she is also becoming increasingly vocal about the dangers of extended school closures. On July 28th, Dr. Asadi brings her concerns to the Merced County Board of Supervisors, a group of leaders also trying to come to grips with the pandemic.
Here in the U.S., here in our county, we are failing our children in our response to this pandemic. I am already witnessing the heavy toll that this is taking on our children. Not the virus itself, but our inability as a society to cohesively respond to it and to acknowledge that it even existed. Some children in our community are now faced with hunger, despair, solitary confinement, neglect, abuse, and in some cases, deportation to other countries to avoid the prospect that a parent has to face of leaving their child home in an unsafe environment while they go to harvest our food. I am not talking about refugees in a third world country. I am talking about real kids, real circumstances here in Merced, California, United States of America. Months ago, our experts sitting behind me in the health department outlined in great detail the protocols necessary to reopen schools safely. I suggest that every adult in a decision-making capacity please put politics aside, work together to ensure that our schools pre-K through 12 are ready to go as soon as we can meet those metrics. Unfortunately, there are 3 metrics that I also want you to pay attention to: the teen suicide rate, the teen pregnancy rate, and the teen dropout rate. Again, by being in denial about this pandemic, we have now failed our kids. I own that, we must own that, and we must work together to make it better.
Working together, however, can be an elusive concept when people are dealing with fear, uncertainty, mixed messaging, political differences, and defiance. Merced County Sheriff Vern Warnke supported the initial stay-at-home orders in March, but by mid-May he is frustrated with state mandates affecting the local community and potential penalties for non-compliance. In a letter to the state of California, the sheriff takes a stand against the governor.
The cure should not be worse than the disease. So the answer you are looking for is this: I will not be taking any enforcement action in this county for any of the COVID-19 violations.
Warnke's letter becomes highly publicized, and it joins a mounting chorus of dissent that is shaking a fragile unity.
The unconstitutional and unbelievable statement of Gavin Newsom yesterday was very disappointing, and I hope the county can assure that no one in this county would be arrested nor detained for worshiping in a house of God. Our governor has said we must close churches down again. Walmart's open, Target's open, all these buildings are open. but my church is supposed to make me sick. I come into my church, they take my temperature. We have social distancing. We're asking people to wear a mask. We don't have children's church right now, so families aren't coming because we're not supposed to have children mixing with each other because they're worried about COVID-19. Yes, I know people who have gotten COVID-19. I know it's right. I know it's there. I know it's a real thing. But I also know it's a real thing that when we can't teach our children right from wrong, when we can't stand up, when our governor makes illegal, unconstitutional, and unbiblical decrees, that we need to stand up. If we have to, we'll call our church services this weekend, protest. We're going to protest against our governor, against the state of California.
They let us do one thing and then they take it away from us in a week, days, we don't know. There's too many inconsistencies that go along with this that it's hard for a business to prepare.
The employees wanted us to shut down fossil farms. That could be millions or maybe $1 billion of industry that an economy suffers. And how are you going to put out a business at the same time you're going to cut the jobs of 3,000 plus employees, right? So they want us to shut down, but who's going to pay the employees?